Welcome to my talk. Today, as also introduced by Jonas, I'll be talking about microdosing and whether and how that can be potentially applied as a treatment strategy for ADHD. And I also think that was a very nice introduction already by the mosaic presentations about this topic as well. So before we start, Jonas already introduced me, but a little bit about me. I first started working on this topic while I was writing my bachelor's thesis, and that's when I got interested in this field. Ever since then, and also during my master's, right now at Master's University, I try to get involved in projects on this topic. And today I'll tell a bit about why I think this is a worthwhile research direction to go into. So first, why ADHD? Well, recently, as you probably know, there has been a surge of interest in microdosing, both from a recreational perspective and also for self-medication for various disorders. And indeed, observational studies find that one large proportion of microdosers are actually patients with ADHD who self-medicate to relieve their symptoms with microdoses. And this increased interest in microdosing from ADHD patients might stem from the fact that current stimulant medications, the first-line treatments for ADHD like Adderall and Ritalin, although they are safe and efficacious when taken in the prescribed doses and for the short term, they might lose their efficacy in the long term when taken for an extended period of time, and also their use is associated with some unpleasant side effects. The most consistently reported one is the energy crash that happens after the dose wears off, also loss of appetite, insomnia, and they also have a relatively high abuse potential as well. So also in up to 30% of ADHD patients, stimulant medication either doesn't adequately relieve the symptoms or they're just intolerable side effects, so they cannot really be used. So as you can see, there is an unmet medical need here, and ADHD patients themselves try to fill that need by seeking alternative ways to treat their symptoms, for example, by microdosing. But what is microdosing exactly? What does it entail? We already had kind of an introduction on this, but just to reiterate, microdosing can be defined as the repeated administration of very low doses of psychedelic drugs, usually with the intention of improving your mental health or well-being, or to improve your cognitive or emotional functioning. And the doses that are used are subperceptual, so they're below the threshold of a trip. They don't have any effects of intoxication or any noticeable drug effects whatsoever. So they don't impair normal functioning. But the exact dose, as also you can see from the slide, the exact dosages are not very well defined, and they probably are individual. They vary with the individual, so it's hard to give an exact definition of what exactly a microdose is. So it's anywhere between 1/10 and 1/20 of a full recreational dose. And these doses are usually taken in a pre-specified dosing schedule or dosing frequency. And there also is no universally agreed upon dosing schedule that is the one. People, again, it's probably individual, and people either take them once daily or once every other day, or follow the so-called Fadiman protocol, which entails 2 days of rest between dosing days. But then, how can we then use microdosing for ADHD? What does the literature say about it? And the bulk of studies done on this topic are qualitative observational studies that use self-reports of microdosers, and they generally find support for this claim. They generally find improvements in cognition, perceived improvements in cognition, of course. Microdosers report being able to more easily direct and sustain their attention, to be more productive at work or at school, to procrastinate less, and to be able to follow through with a task or a project until its completion. And also a more longitudinal-based observational study also found that there were some more sustained changes in the capacity to sustain attention, and that was evident from a significantly reduced mind wandering, which is connected to distractibility, and also a significantly increased absorption, which is a type of focused attention that is characterized by a deep involvement in the task at hand. So this study suggests that with repeated doses, there might be some subtle changes in the attentional capacity with microdosing. And as also hinted beforehand, ADHD patients also use microdoses to self-medicate, and they find them as effective or similar efficacy for their symptom relief and also less side effects than stimulant medication. And some of them even replace their prescribed stimulant medication with microdoses, and they do so successfully, or so they report. This might be due to the fact that microdoses do have less side effects or perceived less side effects than stimulant medication, as I already mentioned. Or it might be due also, Fadiman and Corp speculate that the psychedelics themselves are also stimulating in nature, have the stimulating effect. They don't work on the same neurotransmitters. They're not as noradrenergic as stimulant medication. They're more serotonergic, but perhaps this stimulating effect is enough to also feel benefits for ADHD patients. But of course, this is not backed up by any study or data, just speculation. And also here you can see some quotes, some excerpts from self-reports of microdosers, which I thought were very illustrative of what the experience was like for people who microdosed. And as you can also see, they also report that they found it as helpful or even maybe more helpful than stimulants in the latter case. And also, I think it's important to see that they perhaps enjoyed it more, the experience themselves. They didn't feel forced to focus that much, and they were more easily got into that flow state, which also necessitates the involvement of motivation as well. So it seems very promising from these qualitative studies, and James Fadiman, who's also called sometimes the father of microdosing research, has also suggested that low doses of psychedelics might be an extremely healthy alternative to Adderall in an interview he did with the Rolling Stone. Albert Hoffman himself, the creator of LSD, also has suggested that low doses of LSD might be a suitable and healthier alternative to Ritalin. But of course, all of this is based on qualitative studies, as I said. And there are some quantitative, more rigorous lab-based studies done as well, but they find mixed results on this topic. For example, most studies find either no or only minor effects on cognition. For example, an increase in the number of attempts at a task, but not necessarily the performance on the task, or an increase only in the subjective feeling of productivity, but not necessarily the productivity itself, or only slight improvements in selective attention that was found in an ibogaine microdosing study. But those are, again, not very conclusive. And perhaps the most consistent finding from these studies is done by this double-blind study by Yanakieva that found significant changes in time perception. And they argued that these results might be driven by changes in attention, because they argued that time interval perception is closely related to more general cognitive functions like attention and working memory. So they argued that perhaps the microdoses that were used in the study made participants be more attentive towards the duration of time during the task, and that's what led to the over-reproduction of the time intervals. But this is somewhat an indirect evidence for support for the qualitative studies I just mentioned, but again, far from conclusive. And also mentioned in the previous presentation, Nadia Hutten did a nice study about BDNF, and she found that low doses of LSD were able to increase BDNF levels and thus also neuroplasticity. And this in itself is an important factor for therapeutic effect. So this in itself might underlie a more general therapeutic effect of microdoses, and perhaps even also a specific therapeutic effect for ADHD, since ADHD patients also feature alterations in BDNF and also some learning dysfunctions. And neuroplasticity is involved in learning as well, in memory. But even if microdoses are safer and have less side effects than stimulant medications, there still are some unwanted effects of microdoses that should be taken into consideration. A study reported that about 1/5 of participants that microdosed reported some side effects, but those didn't really last in the long term and were not that serious. So, for example, some studies reported slight increases in neuroticism. So this is a personality trait that's connected to basically to an increased feeling of negative emotions in general. Also, yes, an increase in the experience of negative emotions, but that might in itself be driven by just the general increase in emotionality that happens with psychedelics. Also, some participants reported feelings of anxiety or overstimulation. This might have to do with the specific type of psychedelic drug that they use. For example, these are more connected to LSD, the more overstimulating effect. Or maybe they just took a dose that was too much, a little bit too much, not that optimal for them. Some participants also reported problems sleeping if they took the microdose too late in the day. Or, yes, accidentally taking more than a microdose and then not being prepared for the experience that will ensue after that. And of course, the illegal status of psychedelics is also a problem because not only there's stigma connected to their use, but also, well, their accessibility is also hindered, and also transparency because you don't really know what you're getting, how pure the substance is, what exactly the dose is. I think a microdosing study also found that a lot of participants didn't really know what dose exactly they're taking, and this has to do maybe with that. And also, some participants also expressed concerns over the lack of research on microdosing effects, especially in the long term. So this is what we're trying to remedy. And as you can see, most of these or might be avoided or at least diminished if the microdosing experience is taken under the supervision of a healthcare professional, for example, and or in a more structured setting where ideally a personalized dose would be used, for example. Taken together, we can say that there is some evidence for the clinical utility of microdosing for ADHD. Of course, we're a long way from actually saying something conclusive about this, but it seems like a promising direction to go into. So if, for example, this was to be implemented and as a treatment strategy, how would that look like? Well, first, as I also mentioned, it would be best if it was a personalized dose and a personalized dosing frequency, because that's very individual to the person, and an optimal dose is something very personal. And not only this, but also the type of drug that's being microdosed, the type of psychedelic drug that's being microdosed should also be personalized to the individual and their needs. Also, as I also mentioned, it would be ideal if that was supplemented by psychotherapy sessions, not only for the therapist to then provide guidance for the experience and then kind of make the person get the most out of it, the most benefit out of it, but also for supervision to avoid some of the side effects that I mentioned, or maybe adjustment of those might be needed at some point. And also something that I think really differentiates psychedelic microdoses and psychedelics in general from current stimulant medication or current pharmacological treatments for ADHD is that perhaps, this is also speculation, but perhaps they might not necessitate their forever use to constantly be used, since I think this is also very well described by this quote that describes the experiences of microdosers in a self-report study. That basically microdoses, and also that's my personal opinion, that microdoses are not medication in the strict sense of the word, as in they don't really give a passive way of treating something where you just take the medicine and you wait for it to work, you don't really have to do much about it, or they try to fix some issue or underlying symptom. But rather they're more like a supplement in the sense, like a tool that still requires some active participation from the user as well, but they just assist you, they give you more control over your brain, over yourself, for example, in this case, maybe to more easily choose what to focus on. And perhaps, as we also mentioned, microdoses are also involved with an increase in neuroplasticity, which also makes learning easier. So perhaps by using microdoses, the user will be able to kind of teach themselves how to deal with their symptoms in everyday life, and perhaps after some time of using microdoses, you won't need to use microdoses, or maybe you would need to use them less frequently, for example. Yes. However, it's also important to keep in mind that the studies done currently, and also the studies that I mentioned during this presentation, need to be taken with a grain of salt, since most of them are qualitative. Most of them are qualitative, so a lot of bias, and all of their conclusions should be supported by more rigorous research. And even the more rigorous lab-based studies also suffer from a lot of methodological limitations, like small sample sizes, for example, that decrease the power, and that undermines their reliability and validity. So future studies should focus on these limitations, and should focus on conducting double-blinded, randomized controlled trials to not only tell us more about the effects of microdoses, also in the longevity of these effects, but also their possible side effects, especially with their repeated use, because we don't really know much about that. And also it would be of value to then also look at how the microdoses compare explicitly to other psychopharmacological treatments for ADHD, and also maybe look into how it would be best to combine microdosing with psychotherapy, for example. And as you can see, we still have a long way to go and a lot of more research to do before we can say something conclusive about this. In the crossroads of the psychedelic research, I think that ADHD is a viable direction to go into, since, well, ADHD patients themselves use microdoses and report benefits from them, so it would be beneficial to look more into why they find it so beneficial. Why does it work for them? But also, as I also already mentioned, the potential implementation of this treatment strategy would then necessitate the synergy of many different disciplines and professionals, not only different kinds of scientists and clinicians to aid us in our knowledge about microdosing and psychedelics and how to best apply them in clinical situations, but also politicians and policymakers and educators that will kind of negotiate the transition of microdoses into the mainstream. So this was what I wanted to tell you. Thank you very much for your attention, and if there are any questions, I would be more than happy to answer them.
Very good. Are there any questions, and where is the cube? There it is. I think Lucas already asked a lot of questions, or maybe we hand the cube towards the back a little bit.
All right. So thanks a lot for the presentation. I honestly was surprised that microdoses of LSD were even considered for the treatment of ADHD, because to me it seems that psychedelics could have quite paradoxical effects on attention. And I'm thinking about high doses especially, and for example, one marked effect of high dose of psilocybin or LSD is the impairment of a sense of time, and then that's actually a symptom of ADHD. Mm-hmm. So I'm thinking, do you think there's actually a kind of biphasic effect of psychedelics? For example, a low dose of psychedelic would enhance attention, whereas increasing with the dose, there would be increasing impairments? Or maybe do you think that there is a differential effect on different types of attention, for example?
Mm-hmm. Yeah, a very good question. Also, as far as I know, research on high doses of psychedelics and cognition generally result in the fact that high doses impair cognition and cognitive performance, especially the higher cognitive performance. So this was also a critique on some microdosing papers that say, well, I mean, if higher doses impair cognition, then what is the reason for us to think that lower doses will actually, be beneficial? And I don't have a straight answer to this. I also think this is a strange phenomenon, but the fact is that some patients find it helpful, and they even go to the fact that they go to the extent that they replace their current medication and successfully do so. So yeah, it would be interesting to look more into that. I don't think we still know enough to answer this question, but it would be nice to look more into the neurobiology as well to see what exactly happens in the brain. Yeah.
Okay, thank you. Would you like to?
Okay, so we have another question from our online participants, from Marius Susu. First of all, congratulations. And how do you think the users can be taught to deal with the symptoms? I didn't understand that idea regarding microdosing and ADHD.
Yeah, well, this stems from the fact that, well, this is all a speculation, of course, but it's the feeling that I have for it is that also ADHD, I don't think is a disorder in this strict sense of the word, as in there's nothing that needs to be medicated, so to say. It's more so, a neurodivergence of just a different way of perceiving the world and like going through the world. So it's not that you need to kind of fix your brain so it fits into the world, but more so find a way for you to, go about the world in a way that's optimal for you. I think this also kind of feeds into that you don't really need medication in this to try and fix something, because I don't think there's anything to be fixed per se, but just kind of like a supplement, a tool to just assist you, because microdosing in itself, when you microdose, it's kind of like you get into the mindset of a very healthy person, very mentally healthy person, if I can describe it like that. So you can basically, have more control over your cognitive abilities as well, and you can really choose, for example, okay, let's focus on this task now, and yeah, in this sense, I think that maybe it can, with repeated use, the user can then kind of get into the habit of, okay, what do I do now that I want to focus? Like, what's the mindset that I want to get into? And I think psychedelics might help with that as well. But also to answer the question further, I think a lot of microdosers, and especially ADHD patients, also report that a macrodose, a trip, psychedelic trip, is they find it useful for that to kind of like get the effects going, sort of say, and then they use microdosing to then supplement this effect, the beneficial effect that they got from the trip, for example.
Thank you.
Thank you very much. Please give another round of applause to Iva. That's all the time we have for questions. Unfortunately, there will be more time during the lunch break. But for now, I would like to bring up our next junior speaker.